Hello everyone. Today we are going to discuss about Glasgow Coma Scale. Glasgow Coma Scale, it is a part of primary survey. So, what is Glasgow Coma Scale or simply GCS? What is GCS? GCS is simply neurological assessment in trauma patients. This is done as a part of primary survey. GCS has three components: E, V and M. E for eye opening, V for verbal response, M for motor response. First, eye opening. If the patient opens his eyes spontaneously, then the score is 4. If the patient opens his eyes to verbal command, then the score is 3. If the patient opens his eyes after giving a pain stimulus by giving a sternal rub or supraorbital rub. If the patient is open to that painful stimulus, then the score is 2. If the patient doesn't open his eyes by any means, then the score is 1. Then coming to verbal response. If the patient is normal, oriented to time place, then the score is 5. If the patient is confused, he doesn't know where he is, and he doesn't give any appropriate answers, he's confused, then the score is 4. If the patient can't speak sentences and he's speaking only inappropriate words, then the score is 3. If he's making only sounds, there are no words at all, he's making only sounds, then the score is 2. And for the score of 1, he's not making any sounds at all. If the patient is intubated, we cannot calculate the verbal component of GCS, and it is written as VT. Coming to motor response. If the patient obeys your command, then the score is 6. If the patient localizes to pain, then the score is 5. If the patient shows withdrawal or flexion towards painful stimulus, then the score is 4. If after painful stimulus, the patient shows abnormal flexion, then the score is 3. If the patient shows abnormal extension, then the score is 2. If there is no motor response to any sort of painful stimulus, then the score is 1. GCS score is calculated by combining all three components, that is E, V and M. And this score represents the best performance elicited. Suppose to a painful stimulus, suppose left hand is flexing in to response to a painful stimulus, and right hand is localizing that pain. Then since for left hand the score will be M4, for right hand it will be M5. We need to select the best performance, so we'll take it as M5. Minimum GCS that patient can have is 3, that is E1, V1 and M1. Totally 1 plus 1 plus 1, that is 3. GCS cannot be 0. Okay, if the minimum score is only 3. The maximum GCS a patient can have is 15 by 15, that is E4, V5 and M6. Out of all the components, specifically the motor component, it is the best predictor of neurological outcome after traumatic brain injury.
Okay.